Alrighty, we are at 2 p.m. on the dot. So thank you everybody for hopping on. I'm sure that there's a few folks still getting audio set up and hopping on here. This webinar is probably the most popular webinar that we do every year because it is very, very highly practical, looking at real world examples from this past year to better understand both what the government is looking for in the audits that they conduct and how you can improve your own compliance programs going forward into 2020. Just make sure that you're operating in a more compliant way, ensuring that you're adequately protected, and making sure that in the event that there is an audit that occurs from a HIPAA perspective, that you are well covered and protected. My name is Liam. I'm our Senior Account Manager here at Compliancy Group. I'm going to be the one conducting the webinar today. Just a few housekeeping items, okay? Because by and large, we tend to get a lot of questions throughout the webinars about whether or not the slides will be available or whether or not a recording of the webinar will be available. And the answer to both of those is absolutely yes. So if you would like to get an actual recording of this webinar emailed to you, you'll see my information up there on the end. You can either email me or info@Compliancy Group and request a copy of the webinar and we will send it to you. Or if you go to compliancygroup.com/webinar, all of our webinars are recorded and will be posted on compliancygroup.com/webinar so that you can either request access to our archive, okay, and then you'll be able to, whenever you like, view any and all of our recorded webinars completely for free. We have tons of free resources on the site as well, whether it's our blog where we have articles and current events and kind of just keeping you up to date on what's happening within the industry. We have infographics as a good reference point for certain pieces of education that you might want to utilize with your staff, white papers related to HIPAA. All of that stuff is on our website completely for free. And as always, please ask questions. HIPAA is the type of thing where we are under no illusions that this is something that is always simple and easy. I am sure that for many of you, even some of the information that you've been able to find online about HIPAA has probably been very vague and it's unspecific and not straightforward, okay? So if it's a question that we're able to address throughout the webinar today, we're going to have specific Q&A time at the end where I will address all of the questions that come in. But if it's a question more specific to your practice, okay, just reach out to us. We'll happily have a one-on-one conversation with you about your individual needs, because again, HIPAA is not one size fits all. Okay, some of the practical applications of these things will look different for some of you than it will for others, and we're going to be talking about that in just a minute. To give you a little bit of background information on our company, and this is not just to talk ourselves up, okay, and give us just a plug for us. This is really just for the sake of saying and giving some background on our organization on why we are even talking about this, okay? So for the last 15 years, our company has built our organization on the idea of simplifying compliance for these small to mid-sized business so that you are able to very simply just focus on your job, okay? I am sure that for many of you, whether you are a covered entity or if you are a business associate and a healthcare vendor, whatever it is, this is probably not what you want to be thinking about all the time, okay? Our goal for the last 15 years has been to help our clients radically simplify this as much as possible. And we have a proven track record of knowledge and expertise, okay? We have been around for 15 years. We have clients in 34 countries, all 50 states. We have well over 100,000 users on our platform. And in the history of our company, we have never, ever had a single client fail any type of a HIPAA audit, investigation, or be fined, okay? We really do know what we're doing. We bring a significant amount of expertise to this. So understand, as we're talking about HIPAA and we're talking about all of these things, we are not somebody that just read a book about HIPAA and is now trying to, leverage that knowledge, okay, in the market. We've been doing this for a very long time. And before we actually get into the content of the webinar, I wanted to just launch a very quick poll. You will see this come up on your screens here in just a second. It's very simply, are you a covered entity or a business associate. Okay, so covered entity under HIPAA, meaning that you are directly involved in the treatment of patients. Okay, or a business associate, meaning that you are a vendor that might serve the covered entities, providing services to them. Okay, or also if you're not sure and that's something else that you're trying to navigate, go ahead and select that option. We have a bunch still rolling in. We're collecting all of these responses, so just giving it a quick second before we close the poll and go over the results. Right, just another 5 seconds. We have another few people still answering. All right, so we're closing the poll. That should give us a good estimate of who we have on here today. Now, from what we're looking at on the webinar today, roughly 67% of you are covered entities under HIPAA, okay, meaning you are directly involved in the treatment of patients, whether you're an optometrist or a specialist or a doctor or a group of any other kind that falls in that category, or 27% of you said that you are a business associate, okay? The interesting thing, as you'll see as we go through some of the fines that were levied here, a lot of the fines that are levied, okay, throughout the history of HIPAA and also this past year, we're only going to be speaking about some of the biggest ones, okay, in terms of the federal audits, but the applications of this apply very much whether you are a covered entity or a business associate on both sides, okay? The interesting thing with HIPAA, and part of what makes all of this very difficult to navigate, especially when, not necessarily when you're a very, very large organization and you have the resources that you can dedicate towards this, but for the small to mid-sized business, is the simple fact that the law was written to be intentionally vague, okay? Because if you think about who HIPAA has to apply to, you have the largest regional hospital groups and insurance companies in the nation, and then you have the smallest of single doctor practices, all of which fall under HIPAA, okay? You then have the biggest corporations like Amazon and Microsoft and Google, all of which fall under HIPAA, and then you might have a one-man shop IT guy, okay, who is working with healthcare entities, also who falls under HIPAA. And the interesting thing with the regulation is because it is so broad, it comes across as being very, very vague, because it, you know, what is effective for a very large company is not necessarily going to be effective if you are a much smaller practice, okay? The government has taken that into account. The document that you see here on the screen is what they call the 7 elements, okay? It comes directly from the Department of Health and Human Services and the Office of Inspector General. It's what they outline as their boilerplate requirement of HIPAA in terms of what you're expected to be doing on an annual basis. Now, we're going to talk about each of these individual things in just a second, and also as we go through the fines. Really, the most important thing to highlight here before we go any further is going to be that word effective, okay? Understand, implementing a compliance program into any of your individual businesses or practices is not just a matter of checking these things off of a box and saying that you did it. It's a matter of practically understanding what the requirements of the law are and applying it in a way that is effective for you. And depending on the size and the scope and the nature of your business, what is effective for one person on this webinar will not be the same as what is effective for another practice or another company or another business. It is a very individual thing. And even though the requirements are all the same, it must be uniquely tailored to you, which is oftentimes a lot of the reason for why we see these organizations be fined, okay? And as we go through each of these fines here today, you will find some very, very common threads, okay, in terms of the reasoning behind each of the fines. And what HIPAA really comes down to, okay, is first you have the annual risk assessment requirement of HIPAA, which actually breaks down into 6 individual audits. We will see fines as we go through here from organizations that did not conduct a risk assessment, period. Others who maybe did 3 of the required audits and were neglecting the other administrative audits, okay? It's designed to be a very full and comprehensive risk analysis of your practice or your business or organization. Then following that assessment, there's the requirement that you identify your gaps but more than just identifying your gaps, that you are remediating those gaps and actually documenting how that is being remediated, right? A risk assessment means absolutely nothing if all that you're doing is identifying your gaps and can't then prove how you actually filled in the gaps that were identified. Okay, we'll see a lot of fines related to policy, procedure, and training. Okay, the bulk of the regulation in terms of what we usually see even for our own clients really comes down to implementing proper policy, procedure, and training, making sure that these are reviewed and attested by your staff, okay, that they're updated once per year or every 2 years, and that you're then training your staff on those, making sure that they're reviewed. We'll see a significant number of fines coming back to things like business associate management, making sure that you are identifying the vendors that you are working with, if they have access to PHI, executing a business associate agreement and vetting them. Then last is incident management, okay? We'll see a significant number of fines that come back to failure to abide by what is the breach notification rule, okay? In terms of when a breach or an incident occurs, the government expects you to have a very defined process for tracking and managing that incident or breach. And one way or another, okay, every single one of the fines that we're going to be looking at comes back to one of these 6 things here, okay, in some way, shape, or form. And we're going to be kind of unpacking that, but understand before we go any further, this is what HIPAA is, okay? If you are missing any of the things that you see in this wheel here, compliance is binary, right? So there's no such thing as being mostly HIPAA compliant or partially HIPAA compliant. If you were to be audited and you're missing one of these pieces, you would fail that audit, okay? And right now, for every 16 audits that the government conducts, only 1 passes, okay? What we're gonna be talking about here is some of the biggest federal ones in terms of fines that have been levied, audits that were conducted, and the lessons learned. But take this back for the sake of your own practices as we go through here. This is what you need to have in place. And at the end of the webinar, we will give you access to a HIPAA compliance checklist that you can go through your own practice with and just make sure that you have all of these things in place. Now, what causes an audit? Okay, before we actually get into the fines, it's a question that we get quite often about who actually gets audited and why does this happen, okay? Currently, there are 3 government bodies, okay, that conduct HIPAA audits or investigations. The first is the OCR, which is on a federal level. Health and Human Services writes the law. The Office of Civil Rights enforces it, okay? They conduct roughly 27,000 investigations on an annual basis, okay? I think that's what was the updated statistics for 2018, okay? Of those 28,000 investigations that are conducted, most of them come from things like complaints, okay? So when a patient is not happy or they feel like their privacy was violated, that is where the overwhelming majority of those investigations come from. But the interesting thing is that not only does this get escalated to a federal level, okay, the state attorney generals now have the ability to conduct audits for themselves, okay? The OCR does what is usually a series of random audits on an annual basis in addition to investigating their complaints, okay? But the state, on a state level, okay, this is not just something that gets escalated to the feds, okay? Your own state attorney general could investigate you for HIPAA purposes as well, along with the CMS, okay? So the CMS, different from the OCR, might conduct hundreds of thousands of audits on an annual basis, okay? Both from a HIPAA perspective, if you were handling Medicaid, a lot of things involving that as well. But those are really both the different governing bodies in terms of who could audit you. What is most often, it could be a random audit, it could be a complaint, it could be a breach that needs to be reported under the breach notification rule. Lots of different ways that this can occur in terms of how one of these audits can hit your practice. All right, now getting into the actual meat of the webinar today. We're going to be going step by step through each of these individual examples, understanding what happened, what the fine was, and then why the organization actually was fined. Okay, so an organization at the beginning of this year by the name of Cottage Health, okay, they had 2 breaches. The first breach was that PHI was left on a server that was actually accessible right from the internet even from search engines, okay, requiring no usernames or passwords, okay, to be able to get access to those files. Obviously, that is a violation. That was the first breach. The second breach occurred actually as a result of an IT response to a trouble ticket, okay? The way that the server was configured following that IT response left to EPHI being exposed, once again, leading to a second breach, okay, which was reportable under the breach notification rule, leading to an investigation. This organization was fined $3 million, and as you'll see is a very common thread through all of these. The reason why they were fined was not for the breach in and of itself. Understand, the government does not expect you to be bulletproof. No one is bulletproof. Breaches will happen. You should actually expect it, okay? The reason they were fined is because they had failed to conduct an accurate and thorough risk assessment, okay? They had not, as a result of a failure to conduct that risk assessment, they had not remediated the gaps, okay, that would have been identified as a result of that assessment, and they did not have a business associate agreement in place with a company that they were contracting with, okay? So three different things here, but I want to make this very clear before we get any further. None of these breaches were given, or I'm sorry, none of these fines were levied because the organization had a breach, okay? People get fined because they do not have an effective compliance program. In this particular situation and all others, they were missing pieces of that risk assessment, remediation, okay, and they did not have a business associate agreement in place with one of the vendors that they were working with. The second breach, okay, or I'm sorry, the second fine we're going to be taking a look at. Touchstone Medical Imaging was an interesting one because the breach actually happened many, many years ago. PHI was actually visible on a public server, allowing completely uncontrolled access to patient information, which actually exposed roughly 300,000 patients. What makes this situation so interesting is that both the FBI, okay, and the Office of Civil Rights notified Touchstone that this was happening, that a breach was occurring. They insisted that no breach had occurred, so they never fixed the issue, eventually leading to an investigation that identified, yes, a breach was happening, and they were fined for a whole number of reasons, okay? So first, again, you'll find that this one specifically is a remarkably common thread. They had not conducted a thorough risk analysis of their organization. That is the first and the biggest one. They were not abiding by the breach notification rule, okay? The fact that these patients' information was exposed was a breach and a violation, should have been reported, okay, as is required under the breach notification rule. They were notified of it and did not investigate the breach. And the other interesting thing, again, so this is a double whammy between the last one and the first one, they did not have a business associate agreement in place with their IT firm, okay? If there's anything that I can, for both for this situation and for all others, you'll see risk assessments are a big one, okay? But make sure, even as just a practical lesson for this, if you don't have a business associate agreement with your IT company, you need to get that in place immediately, okay? Because almost 99% of the time, the level of access that your IT firm needs to have in order to do their job usually means that they will have access to PHI at some point in time in some way, shape, or form, and it would very, very much behoove you to make sure that you have that agreement in place with them, because it will radically reduce your vulnerabilities. And if you are an IT firm and you are working with covered entities, you really need to be HIPAA compliant, as you'll see from a lot of these different examples that we're going through, okay? And at the bottom here, you'll see little quotes from the OCR director, Roger Severino, where he says, neglecting to have a comprehensive enterprise-wide risk analysis, as illustrated by this case, is always a recipe for failure, okay? We would say that you should take that to heart, okay? So interesting thing with this next fine. Medical informatics engineering had a breach. As a result, in this particular case, they actually are a business associate. Okay, they provide IT solutions along with electronic medical record solutions to their clients. Hackers were able to find a compromised user ID and password that actually allowed them access to approximately 3.5 million patient records. Okay, medical informatics engineering is not a big company. They're actually a small firm, but because of the solutions that they provide to many of their clients, there was millions of patient records that were able to be accessed as a result of that user ID being compromised, okay? Just due to the nature of the size of the entity, okay? It was a $100,000 fine. It's one of the smaller fines that you'll see as we go through here today. And once again, it was for failure to conduct a comprehensive risk analysis prior to the breach occurring, okay? And you'll see again the quote from Roger Severino. Failure to identify those potential risks and vulnerabilities opens the door to breaches and violates HIPAA, okay? If you have not done a risk assessment, you are already in violation of the HIPAA requirements, is what he's saying there. Next one, okay? So Bayfront Health in St. Petersburg. An interesting case because in this particular situation, okay, it was actually a mother who was requesting information and records related to her unborn child, okay? There's any number of reasons for why this could have been a very sticky situation. What happened is that she requested these records repeatedly, okay? There's something called the right of access rule under HIPAA. And under the right of access rule, if you have a patient that requests their healthcare records from you, those must be provided within 30 days of the request. In this particular case, in spite of repeated requests that came from this mother, okay, it took almost a full year before she was provided with them. This led, again, to a complaint being filed with the OCR, okay, and you see a lot of these stem from complaints, not just breaches, okay, leading to an investigation and an $85,000 fine just because they had not reported or they had not provided this mother with those records in a timely manner. Social media is a potential minefield, okay, for HIPAA violations, to put it lightly. And in this particular situation, this was legitimately the smallest fine ever levied in the history of HIPAA, okay? It was a dental practice, okay, that was utilizing different social media platforms for online reviews. In particular, one of the platforms that they were using was Yelp, okay? Basically, what they did is in response to a negative Yelp review, they confirmed the person as a patient, okay, and also referenced in their response that patient's health condition. If this patient was already upset, okay, they really just gave them any more of a reason to file a complaint against them. So again, this led to a complaint, an investigation by the OCR, leading to a $10,000 fine. And again, it was not related to the breach in and of itself. Okay, the fine was because they could not prove that they had policies and procedures in place related to their use of social media. They also lacked a notice of privacy practices that was HIPAA compliant. Okay. When social media, so if you're ever interested, we have, it's another one of our most popular webinars is HIPAA and social media, okay, and how to use social media in a HIPAA compliant way. When you're responding to reviews from patients, you want to leverage those reviews in a very positive way. So it's great to send people to those platforms. But when you're responding, you cannot in any way, shape, or form confirm that that person even set foot into the practice, okay? It should very simply be, thank you very much for the nice review, okay? Or something like that, that does not in any way confirm their identity or anything that they said, even about visiting your own practice. Have to be very careful when you're talking about social media. Next one is Jackson Health System, okay? This one is An absolute mess, okay? And you'll see even the quote at the bottom, all that Roger Severino had to say about this particular situation is that for this organization, their HIPAA compliance program was in disarray for a number of years. Okay, so we have actually 4 different breaches that occurred, and you'll see with all of this all actually comes down not to the organization themselves, but to their staff. Okay, so in 2013, they quote unquote lost 3 boxes of patient paper records with PHI. Okay, I don't know how you lose 3 full boxes of paper records, but they did. Okay, in 2015, PHI of a patient was disclosed without authorization. Now, what makes this one very interesting is that this was not just any patient, it was actually an NFL player. One of the employees within this organization pulled the healthcare records for this NFL player and disclosed it to a media reporter. That's problematic, okay? 2015, again, social media issue. Somebody posted pictures of an operating room display board, okay, onto their social media sites. And as you can imagine, on that display board was a lot of patient information. People did not feel comfortable about that. And then the 4th and final one, an employee had actually been illegally accessing protected health information and then selling patient information on the black market. Okay, part of why the healthcare industry is even such a big target right now from a cybersecurity perspective, and why implementing any number of different security measures, we highly recommend that you work with an IT firm to help you understand the need for some of those things. Understand, a single healthcare record can be sold on the black market for anywhere in between 5 and 10 times more than a credit or debit card number, because that person's information can be utilized for anything from blackmail to identity theft to any other number of applications and resale on the black market. Okay, this, of course, eventually led to this organization being investigated. They were fined $2,150,000 because they had failed to report a lot of these breaches. They had failed to conduct an annual risk analysis, and they had violated what is called the minimum necessary standard of HIPAA. Okay, what the minimum necessary standard says is that if you have an employee, okay, that employee should only have access to the minimum necessary level of information for them to do their job. Meaning that if you have staff in your practice who don't need to have access to your patient's information, they should not by any means have access to that information, okay, is what the minimum necessary standard says, okay? This is both for the protection of that information, and as you can see, 86% of the breaches that happen in healthcare actually are not as a result of failing technology. It's most often failing people and human error, okay? So making sure that you're able to protect against the different types of human error, but also implementing an effective compliance program that would prevent you from being liable in the event that there is human error, right? So conducting a risk assessment first to identify gaps, but also we have had clients of ours, okay, that had breaches due to an employee, say, losing a laptop, okay, but they were not fined because we were able to prove that they had policies and procedures in place related to the use of those laptops that was reviewed by that employee, okay? That is the type of power, okay, that an effective compliance program can bring you in terms of protecting yourself from these types of situations. Next one, University of Rochester Medical Center, okay? Again, 2 breaches. The first breach was they actually they lost an unencrypted flash drive, okay? And then the second breach was in 2017, theft of an unencrypted laptop. Breaches were reported, leading to an investigation by the OCR, okay? The ultimate fine, okay, was for failure to conduct an enterprise-wide risk analysis. By the way, This is the biggest one that you will hear us mentioning throughout almost every single one of these things, okay? That risk analysis, in terms of how the government sees it, is absolutely non-negotiable related to your compliance programs, okay? And then, of course, failure to remediate gaps that would have been identified as a result of that assessment, okay? And then also failure to implement device controls, which again would have been identified if they had done a risk assessment, making sure that those devices were actually encrypted, okay? And you'll see again from Roger Severino, when covered entities are warned of their deficiencies but fail to fix the problem, they will be held fully responsible for their neglect, okay? Because in this particular situation, they had a breach already, okay? The OCR told them what needed to be done, okay? It wasn't implemented effectively, leading to another breach, and then eventually this fine levied in 2019. Texas Health and Human Services Commission. This one is interesting only because Texas Health and Human Services Commission is a state government agency. Okay, so pretty simply, not even the government is safe from the government, okay? In this particular situation, an internal application, okay, was moved from a private server to a public one, actually accidentally making patient information viewable by any number of unknown users or unauthorized individuals, okay? The fine was because it was a $1.6 million fine. Was because they had not conducted an enterprise-wide risk analysis, okay? And they had failed to implement access controls on its information systems and applications, which, again, would have been identified if they had done that risk assessment completely, okay? We've got two more here before, or I'm sorry, actually three more before we get into a couple more practical things, and we'll do our best to answer any and all of your questions. Centaur Hospital, okay. What happened in this case was that Centaur Hospital was sending billing statements, okay, for patients to the wrong people, okay? So it was actually, it wasn't a very large breach. It was 577 patients whose billing statements were sent to the wrong addresses. They improperly reported the breach, okay? And even after OCR informed them that they incorrectly reported the breach, Centaur refused to correct their actions because they said that the information on those billing statements were not PHI. Basically, that here's what their argument was, okay? All that we had on those billing statements was patient names, account numbers, and the date that they were treated, okay? There was no diagnosis information. There was no actual information about the treatment that they were receiving from us. That's not PHI, okay? And all three of those things, okay, are PHI. You know, I'm going to be getting into a little bit around actually what is PHI in just a second. This fine was levied on Thanksgiving Day of this year, of 2019, $2.175 million because of their refusal to report the breach properly in conjunction with the breach notification rule. This is back to incident management. And they actually did not have a business associate agreement in place with their parent company, who was the one in charge of mailing those billing statements, okay? Lots of different layers to this one, but understand when we talk about PHI, let's just take a second and discuss actually what is PHI. PHI is any unique identifying information about a patient, period, okay? It is not treatment. It is not diagnosis related information. It is any information about that patient that could be traced back to them. So AKA, what Centaur Hospital says was, all that we have is names, okay? You'll see number 1 is patient names. We also had account numbers on there. You'll see that number 10 is account numbers, and also their dates of treatment, okay? Number 3 is dates related to treatment or the identity of a patient. Any dates, like could it be date of birth, right? Any dates that could be traced back to that patient, it's all PHI. Okay, so understand, if you are not fully addressing, if you are looking at this in the realm of just treatment and diagnosis related information for your patients, you are missing the point, okay? HIPAA protects any of these 18 identifiers. We have actually a really great infographic that lists all of these 18 things. It's a great thing to have posted in like the staff lunch area, okay, or just as a reference point for your staff to look at, so that they know actually what is considered PHI, what can be disclosed and what can't. You want to be very careful with that. Last two, okay. Karuna Medical, in this particular situation, okay, they failed, after several requests from a patient, okay, they failed to forward their medical records in the requested electronic format, and they actually charged their patient for those records much more than with the reasonably cost-based fees under HIPAA, okay? This led to actually one investigation in which the government told them, listen, we're giving you a warning. Here's what you need to do. Here's what you have to implement in order to be doing this in a compliant way. Karuna Medical did not listen. They continued to violate the HIPAA right of access rule by overcharging for those records and not sending them in the requested format, leading to an $85,000 fine. Okay, and this was just a complaint filed against them. Last one, West Georgia Ambulance, Inc. West Georgia Ambulance actually had a laptop fall off the back of one of their trucks, okay? That laptop had patient information on it, okay? Which eventually led, it was a reportable breach, so they notified the government of it, okay? This is a very, very small company, okay? Leading to a $65,000 fine, so another one of the smaller ones that we've seen among these. And the reason for why? They had not conducted a risk analysis. They had not trained their staff, okay? And again, they had that loss of a laptop. They could not prove that they had policies and procedures in place related to the use of those laptops, okay? All of these things could be easily resolved through the implementation of an effective compliance program. Now, here's what you don't want to have happen, okay? I would challenge you to look into any of the organizations that we discussed today, okay? Here's what you don't want to see when somebody Googles your practice or your business or your organization. You don't want to see an HHS press release about the fine that was levied against you for you not being compliant and protecting your patient or client information, and you don't want to see the wall of shame. If you've never ever heard of the OCR wall of shame, I highly recommend that you Google it. Every single breach of more than 500 records is entirely public
Hey there, everyone. This is Sabrina from Compliancy Group. I'm on the marketing team here. It looks like Liam is just having some technical difficulties. He's lost some audio. He should be back on momentarily if you could just hold on. Sorry for any inconvenience.
Hey folks, Sabrina, am I coming through now?
You are coming through.
I am so sorry about that. I don't know what happened. It was either my computer completely died on me, or I genuinely have no clue what happened. I had to do a restart. So again, everybody, please forgive us for that. Thank you, Sabrina, for being on here and for taking over. Very much appreciate that. Now, all that I was saying, folks, is related to the HHS wall of shame. This is exactly what you do not want somebody to see in reference to your organization when they're Googling you, okay? If we're talking about bad press, this is probably the worst thing that you could have happen to you and what you want to protect against. Now, as you can see, whether it is in any way related to fines that have been levied in the past, okay, or if it is fines that were levied throughout this past year, all of it comes down to each of those different 6 things that I was talking about at the beginning, okay? An annual risk assessment, okay? With that risk assessment then comes gap identification and actually remediating the gaps that you identified, okay? With remediating those gaps, then ensuring that you are in a position where you have policies and procedures in place, okay? That your staff has been trained, that you have business associate agreements executed with each of the different vendors and firms that you might be working with, okay, that have access to that data, all right? And then, of course, that you have an incident management plan, that you understand the breach notification rule in terms of what the requirements are and what you need to be doing to handle those different types of breaches in terms of the many, many different things that could be happening, okay? All of these things, extremely important and relevant in terms of how you handle it, okay? And for those purposes, that's really everything that we're here to help with. So if there's any particular questions at this point in time, we would love to be able to address those. Again, my name is Liam, so my contact information should be popping up right there on the screen. You can reach me at my number and my extension, or if you want to shoot me an email, I'll either have myself or somebody in our team follow up with you to get those issues resolved. And then if there's anything else at this point in time, we'll go ahead and answer any of those questions that come through. Sabrina, are you still on?
Yes, I am here. Yeah, so I've been tracking the questions as they're coming through, and there's a lot of good ones. So if you're ready for the first one, I can give that to you, Liam.
Yeah, go right ahead.
Okay. Looks like someone had a question on reporting a breach. It says, how long does an organization have to report a breach that has occurred with their organization?
So with the breach notification rule, okay, and it's a very good question. Breach notification comes down to 2 things, okay? First, in the event of a breach, you're obviously required to investigate that breach to figure out what exactly happened and how many patient records were violated, okay? If it is less than 500 records, that's considered a minor breach. You're required to report it to the OCR by the end of the calendar year, okay? You also need to notify the patients that breach occurred, okay? Now, if it is over 500 patients, it's a little bit different because then it's no longer by the end of the calendar year. It is within 60 days. You need to notify both the government that the breach occurred. You have to notify the patients, and you actually also need to notify the local media outlets, okay, or your local news station or the paper that the breach has occurred, so that they can get the word out to as many people as possible that there was a breach, okay? So it can get a little bit sticky. But those are basically the general rule of thumb requirements in terms of what you need to be looking out for.
Great, thanks for that answer, Liam. Another question that came on in was about business associate agreements. Is a business associate agreement always required with a covered entity?
So it depends on if this question is coming from a business associate or from a covered entity, okay? Because covered entity to covered entity interactions actually do not require a business associate agreement, okay? But if you are a covered entity working with a business associate and they have access to any type of patient information in any way, shape, or form whatsoever, you are required to have a business associate agreement in place with them, okay? You're actually also required to vet them. Okay, it's called a technical due diligence, which very simply means you need to make sure that that vendor is trustworthy prior to engaging with them, making sure that they have the necessary privacy and security requirements in place as well to protect that information.
Okay, great. There was a lot of questions actually asked about the risk analysis. So I'm going to just pull one from that. Is completing an SRA enough for my business? So they're relating, this sounds like they know what they're talking about, a risk analysis. Is that enough for their business?
So it's a good question, but somewhat misguided in the sense that we have seen, so a lot of the companies understand that we're fined for a missing risk analysis had done a security risk assessment. Okay, so if you're working, say, with your IT firm, okay, or another entity in which you're performing a security risk assessment, an SRA is usually going to be focused on what are the technical or the physical security requirements of HIPAA. Okay, the other 50% of the annual risk assessment actually deals with not just the security piece of things, but your policies, procedures, operations, your administrative requirements, and that's all about that human error component, right? So a security risk assessment, not necessarily enough to satisfy the HIPAA requirements. It really does need to be all 6 of those individual audits, which would make up a full risk analysis, as HIPAA calls it.
All right, moving on. Someone wants to know if you have any tips for them on protecting their business from hackers.
In terms of protecting your business from hackers, okay, number one recommendation would be to speak with a third party. Okay, so there's even our company, we are connected with anywhere between 500 and 600 IT firms throughout the country that we actually are able to recommend our folks to, okay, that are HIPAA compliant, able to sign a BAA, and have the ability to educate you on what different security measures you can have in place. All right. If you would like us to put you in touch with somebody like that, we would be happy to do so. Really, the best way to address those types of risks is by taking it out of your own hands and letting somebody else with that legitimate expertise be able to handle it.
All right, and it looks like we can answer one more question related to policies and procedures. Someone is asking how to create or gain access to policies and procedures. I guess they're looking for some answers on how that's created and how to get it.
I'm sorry, can you say that one more time, Sabrina? I'm sorry.
No problem. So it looks like someone's looking for a question on how to create or gain their policies and procedures for their business. So I guess they're looking to see how they can get that information.
Yeah, sure. So lots of different ways to create your policies and procedures. You could, of course, reach out to your lawyer, okay, and see if it's something that they could assist you with. You could also reach out to your, if you're a part of a specific medical association. So let's say you're an you're an optometrist. Okay, you could reach out to the AOA or the American Optometric Association if you're a member of that. And see if they have specific policies and procedures that you would recommend to them to use. This is going to be somewhat of a shameless plug for Compliancy Group, but understand we have a software platform that satisfies all of these different requirements that you hear us speaking about. So from your annual risk analysis to remediation planning, policies, procedures, training, business associate agreement tracking, incident management. It's designed to cover absolutely everything, and because it's a software-based approach, it's remarkably cost-effective. So even as I'm scrolling through some of the things here, I see people asking, what we recommend if you're a small practice. We built this to be extremely affordable and accessible, even if you're a one-man shop. Okay, and I hate to plug for us, but if you have a need to do this in a cost-effective way, and also in a way that's just convenient and a little bit more streamlined than doing it on your own, we would love to speak with you about how we can be able to do that. And actually, I saw one more question that I thought was a good one. I apologize. We have had a huge influx of questions coming in. So if we did not get to your question, we will follow up with you. Somebody in our team will reach out to you and make sure that we can get that question resolved within the next 24 to 48 hours. One question that we got: is a business associate agreement the same thing as a data use agreement? The answer is absolutely not, okay? So things like there are many different types. So let's say it's a software vendor, okay? You're going to sign a software licensing agreement. There's going to be different clauses in there related to data use and accessibility and indemnity, all of those different things. That is not the same thing as a BAA, okay? A business associate agreement can't just be bundled in, okay, with the current service agreements or data use agreements that you have in place right now. It must be executed and tracked separately. So keep that in mind. So if you don't have any of those things, make sure that that is being done and handled. And again, that's something that we'd be happy to help you with, all right? And, we're closing in on about 52 minutes here. So for the sake of being respectful of everybody's time, there was a significant number of questions that we were not able to get to. I very much apologize for that. But I see a couple of questions in here, just to get a couple of these through very quickly. If you would like a recording, send us an email, either contact info@Compliancy Group or shoot me an email directly, and we will get you that recording. Okay. If you want the slides, same thing, just shoot us a request for them, or you can go to compliancygroup.com/webinars, and you can fill out a form requesting access to our entire webinar archive, just giving you access to our full webinar database. Okay, so either of those options, happy to assist however we can. Any other needs, please reach out to us. If there's a question that we were not able to address throughout the course of this webinar, I promise a member of our team here will follow up with you within the next 24 to 48 hours so we could get that resolved. But in conclusion here, thank you all so much for your time. We very much appreciate it. And if there's any kind of final takeaways, okay, if you have not conducted a risk assessment, that is the best place to begin, okay? Because that risk assessment is designed in such a way, okay, if you're doing your HIPAA risk analysis, it's designed in such a way that it'll allow you to identify your gaps in all of these other areas and then be able to come up with a plan to resolve it, okay? So kind of our main takeaway for today, you see the overwhelming majority of the organizations that we looked at were fined partly because of a failure to conduct that risk analysis. If you need help with that, or if you'd like to learn more about what we do, please reach out to us. We would be happy to assist. There's many, many different ways of doing this. You do not need to use us, but we would love to be able to help, okay? So again, reach out to us. Thank you all for taking the time to sit in on the webinar today. We appreciate it. If there's anything that you need, just let us know. Have a great day.